really thought he impressed me from the very beginning. So he came in, this was a different career for him, and he just always hit the ground running. He wasn't afraid to just do what he needed to do to learn something completely different.
He is compassionate and very caring. We don't spend a lot of time with our patients when they're awake, but he does go out to the pre-op area and greets everybody with a kind of warm, calming demeanor. He's kept the same positive outlook and love about what he does since the day he walked in the door.
Roxy goes above and beyond every single day, and everything that she does, from teaching her orientees to running charge nurse to participating in rounds and mobilizing her patients, she just excels in all of it, and she provides excellence in all that she does.
She brings that joy, that sunshine into the home. I have many letters where the family has said that they would not have gotten through the experience without her help, that she guided them all the way through, that she was the expert in the pain and symptom management, and that she was also the cool, calm, soft voice that gave them the courage and the strength to move through, for many folks, the most difficult situation they've ever been in. They feel like she's an angel coming into their home.
Usually the emergency department will take 1 to 2 new students per year. Marcus, in his enthusiasm, says, let's take 7. And we all looked at him and kind of said, what? How are we going to do that? But then you figure it out. And we took 7 students. All of them are just now soaring with what they've learned. And we hope that this group is the group that we're growing for the future. And they are just diverse, they're exceptional. And this was all because somebody said, hey, let's step outside of our box, and let's not just take 1 or 2, let's take 7.
We get that feedback from people all the time about how much she's able to connect with them and relate to them, regardless of if it's a friend or a family or the patient. She can do these things, so it's more than just critical care skills. She has an uncanny ability to relate to patients as if she's one of the patients laying in the bed. She looks for things beyond what other people would consider and finds ways to really inject herself and her personality into her patient care.
Samantha was working her list one day and she came across a patient who was due for the mammogram. She called the patient, told the patient, and the patient said that they would go have it done. The next month she was still on the list, and the month after that she was still on the list. So Samantha kept calling her to remind her. She got in for a mammogram, and the week after that she called Samantha and said to her, thank you for saving my life, because they caught breast cancer in stage 1A. And if you hadn't kept hounding me to go for my mammogram, I may never have known. That makes everything that we do all worth it, because you saved one patient's life perhaps, and that patient made her feel so good and appreciative of what she did every day.
She's a pillar for us in the OR. She's our go-to for any type of questions regarding her service line along with other service lines. She's a wealth of knowledge, not just in her service.
If you look on a canvas that is just empty and you allow her to draw the picture, you would have a beautiful masterpiece. In all her years of experience as a nurse, in all her years of caring for patients, in all her years of just knowing the trade, it's been a beautiful picture that I can see from the outside looking in. I met Linda in '08, and I've learned a lot from her, and I respect her, and I love her.